Before you spend thousands of dollars on dental implant treatment, I want to go over 7 reasons why dental implants might not be right for you. First is health and healing. A lot of patients are told they don't have enough bone. So the dental implant is the screw portion that goes into the bone itself and actually fuses to the bone so that you can have a good solid foundation. It's basically a root replacement for your tooth so that later you can get a tooth put on top of the dental implant. And so you need a good bony foundation in order to have a good stable base around the implant. However, as a specialist, it is my job to make everybody a candidate by finding bone, whether we use natural bone that you already have, we do bone grafting, build up bone as needed. We want to make sure that you have the right plan in place. So you need good solid bone. If you don't have enough bone, we need to get you bone. The second thing, medications that affect bone healing. So not only do you need enough bone stock in order to place an implant in, but you also need to have good bone healing afterwards. And there are some medications that are used for osteoporosis that build up strong bone. However, its process to work requires the bone turnover rate to slow down. So it slows down so much that when you do an oral surgery procedure where you're placing an implant, the bone is so slow at healing that the bone can actually die as opposed to fuse to the implant and give you a nice stable foundation. So tell your dentist or your oral surgeon what medications you're taking. So the third thing that you might not have is other uncontrolled medical conditions. So your body needs a lot of healing time and energy in order to heal properly. So if your body is fighting a severe infection, maybe it's not the right time to get the dental implant in there. If your body's fighting uncontrolled diabetes and it's a raging diabetic ketoacidosis, that's not the right time. There are other things that you need to focus on before getting a dental implant. So let's get that under control first so that you can become a candidate for dental implants later on. Reason number 4 is maybe you're still growing. Males stop growing in the jaws at around age 21 and females stop growing in the jaws around age 18. But if you're still growing, dental implants may not be the best option for you. We want to make sure that when we place a dental implant, it's going to be in the right place for a very long time. Number 5, smoking. If you're a heavy smoker, what can happen with the bone and the soft tissues, the gum area, it decreases the amount of blood flow to the area and decreases the healing process that can occur. So it really slows down healing, so we got to be extra careful. In full arch treatment, when you're getting this done, smoking hasn't really shown to be a big factor in this. But for single tooth implants, smoking has a negative effect on a single tooth implant healing. So when they're all tied together, it shares the force of the load, but when it's a single tooth, it can take a lot of pressure in every direction all by itself, and so the healing process can be quite different for a single tooth implant as opposed to a full mouth of dental implants. Reason number 6 is poor oral hygiene habits. Implants don't get cavities, which is good, but they can get infected. So if you have a lot of gum disease, that same bacteria can infect the gums around a dental implant and cause a lot of bone loss. Reason number 7, unrealistic expectations. Dental implants are a big investment. They take time, energy, and there's a cost to it. And these are all things to consider when getting dental implants. It's not something that you can just say, I'm gonna take out all my teeth, I'm gonna get dental implants in, and I'm never gonna have to worry about it afterwards. No, there's a lot of care that goes into it afterwards. You still need to do your dental cleanings every 4 to 6 months. That needs to continue. You need to do good oral hygiene habits daily. You need to give yourself time for the healing. The tongue is gonna suddenly feel like it's been pushed around. It's gonna feel like it doesn't have enough space. These things can be overcome, but we wanna make sure that you have the right expectations beforehand so you know what to expect and how to handle them. And when they come to you and you experience these things, you know exactly what to do. And another reason why you shouldn't get dental implants is because you haven't found an oral surgeon that you trust. And so what I recommend is finding one that you really can build that confidence with. And so what we've done is that we've created a checklist for you. So click the link below and download the checklist of questions to ask your dental provider prior to getting dental implants.